1 out of every 200 Americans is living with limb loss. Major causes include diabetes, vascular disease, infections, accidents, and war wounds. Yet many insurance companies don't cover the cost of a prosthesis, preferring to pay for less expensive wheelchairs. But now, as NJN News health and medical correspondent Sarah Lee Kessler reports, some amputees are fighting back.
Most insurance companies classify artificial legs as durable equipment. That's the same category as wheelchairs. Amputee Dennis O'Donnell says that's just wrong. He hails a new law passed 6 months ago that makes New Jersey the 11th state to require insurance companies to cover prosthetics at the same rate as Medicare.
Before this law, I spent probably almost the first 2 years in a wheelchair because I didn't have the coverage I needed.
Now O'Donnell has two $50,000 sea legs, computerized prosthetics that provide more stability.
They enable me to walk without having to constantly think, where's my toe, where's my heel.
It's going to work on your balance.
Maurice Stremlow's insurance company initially agreed to pay for a much less expensive manual prosthetic.
Where I have to control it and I have to think more so about every step that I take. That was very discouraging because you're already discouraged at the thought of being a new amputee. So to have that on top of that, it just weighs you down even more.
Stremlow's physical therapist, Stacy Halverson of Capital Health System in Trenton, agrees.
If they don't have the proper prosthetic, I cannot give them effective rehabilitation services, so it's very frustrating.
But now, because of the new law here in New Jersey, Stremlow's insurance company will have to pay for a smart leg, a sea leg. It will arrive next week. But there are exceptions. Any company in New Jersey whose corporate board is located outside the state is exempt from the New Jersey law. So are companies that are self-insured because they fall under federal statutes. Currently, there is no federal law that mandates prosthetic coverage.
They've paid millions of dollars for every other procedure, but they won't pay for the one thing you need to get back to your life, to get back to working, back to being a taxpayer instead of collecting money from the taxpayers.
Physical therapists and their patients are pushing for passage of a federal Prosthetic Parity Act. Sarah Lee Kessler, NJN News, Trenton.